The human eye is a highly specialized organ, capable of detecting light and converting it into neural signals. Externally, we see the sclera, the white of the eye, and the transparent cornea at the front. Just behind it, the iris controls light entry through the pupil. Inside, the crystalline lens focuses light onto the retina, an intricate layer of photoreceptors. These signals travel via the optic nerve to the brain, allowing us to perceive the world in vivid detail. Eye disorders affect millions globally. Cataracts cloud the lens, leading to blurred vision. In glaucoma, increased intraocular pressure damages the optic nerve, often without symptoms until advanced stages. Age-related macular degeneration affects central vision, while diabetic retinopathy damages blood vessels in the retina, leading to visual loss if untreated. Early detection is critical to preserving sight. Vision begins when light enters the eye. The cornea bends the light, the lens adjusts the focus, and the image lands on the retina. Rods detect light intensity, while cones interpret color. These photoreceptors convert light into electrical signals that travel along the optic nerve to the visual cortex of the brain. There, the image is reconstructed, allowing us to see clearly and interpret our surroundings. Cataract surgery is one of the most common and successful procedures worldwide. Under local anesthesia, a small incision is made in the cornea. The cloudy natural lens is broken up using ultrasonic energy and carefully removed. An intraocular lens is then implanted in its place. Most patients experience improved vision within days, with minimal discomfort and high success rates. Modern ophthalmology relies on advanced diagnostic tools for early detection and monitoring of eye diseases. The slit lamp provides a magnified view of eye structures. Optical coherence tomography, or OCT, captures cross-sectional images of the retina. Retinal photography documents changes over time, and visual field testing assesses peripheral vision. Together, these tools offer a comprehensive look at eye health and guide personalized care. The human eye begins to form just 22 days after fertilization. Arising from the neural tube, optic vesicles extend toward the surface ectoderm, inducing the formation of the lens play code. This structure invaginates to form the double-layered optic cup, precursor to the retina and other ocular tissues. Vascular development follows, feeding the growing eye. By the 8th week, the major anatomical components are distinguishable, though final maturation continues through gestation and early infancy.
The retina is a layered neurosensory tissue that lines the back of the eye. It contains over 120 million rods for low-light vision and around 6 million cones for color and detail. Light entering the eye stimulates these photoreceptors, which convert photons into chemical signals. These are relayed through bipolar cells to retinal ganglion cells, whose axons form the optic nerve. The retina not only captures images, it encodes complex data about shape, contrast, and motion before the brain interprets them. Refractive errors such as myopia, hyperopia, and astigmatism occur when light does not focus correctly on the retina. Glasses and contact lenses work by adjusting the path of incoming light. A concave lens spreads light rays for myopic eyes, while a convex lens converges them for hyperopic eyes. Toric lenses address astigmatism by compensating for irregular corneal shape. Contact lenses sit directly on the cornea, offering a wider field of vision and more natural correction for many users. Vision doesn't end at the eye, it continues deep into the brain. Signals from each retina travel through the optic nerves and converge at the optic chiasm. Here, nasal fibers cross, ensuring that visual information from the right field goes to the left hemisphere, and vice versa. The lateral geniculate nucleus in the thalamus relays this data to the primary visual cortex in the occipital lobe, where images are processed for shape, motion, color, and spatial awareness. This network allows seamless, binocular vision. LASIK, laser-assisted in situ keratomileusis, is a surgical technique to correct refractive errors. The procedure begins with detailed corneal topography mapping. A femtosecond laser creates a thin flap in the cornea, which is gently lifted. An excimer laser then reshapes the underlying corneal stroma, adjusting its curvature to correct vision. The flap is repositioned, healing naturally without stitches. Most patients experience rapid visual recovery, reduced dependence on glasses, and long-lasting clarity.